Okay, class, welcome back. In this next section, we're going to be talking about quadrants. When we look at the word quadrant, we'll see quad, like quadriceps, four. And what we're doing is we have this sagittal line, right, going down right down the center. We have this sagittal plane here, and then we have this line going horizontal to it, right through the umbilical region, and it divides into four different quadrants. There is a right upper quadrant, a right lower quadrant, a left upper quadrant, and a left lower quadrant. Now, especially in nursing and in healthcare, right, you may see a report where a patient comes into the clinic complaining of pain in the right lower quadrant, right? They have like a diagram. It'll say mark it up where your discomfort is. It'll say here. So that's the right lower quadrant. On a scale of 1 to 10, on a scale of 1 to 10, the individual says it's an 11 plus. Okay. So we know that they're in a lot of discomfort. Patient has 103 fever. They are antalgic or cramping over. And you start to kind of put everything together and you're thinking anatomy and physiology, and you start going, all right, what do we have in this right lower quadrant that could create so much pain and discomfort? And then, of course, you'll remember back to Dr. Lindner's class of all the classes, and you'll be going, all right, I know there's part of the colon, there's part of the small intestine, but right here is the vermiform appendix. That's the appendix or the vermiform appendix. So upon palpation, there was extreme tenderness in the right lower quadrant. So that means upon touching that area, especially with McBurney's point, McBurney's point is going, okay, here's the belly button, here's the umbilicus. You will learn a landmark called the anterior superior iliac spine of the ilium, and then halfway between those points is called McBurney's point, and that's where the appendix is. Right? So then you do a complete blood count, and you may find that, whoa, their neutrophil count is really high. The neutrophil count. And you'll learn that we have different types of white blood cells. One of them is a neutrophil. And when the neutrophil count is really, really high, that's seen with a bacterial infection. When the neutrophil count is high, it's a bacterial infection. When the lymphocyte count is high, when the lymphocyte, there's that site, right? You've learned that already. Site is cell. When the lymphocyte count is high, then there's a viral infection. When the neutrophil count is high, there's a bacterial infection. All right. So if this ruptures, you can have a lot of bacteria that's stored in that vermiform appendix. It's not an extra part, it's lymphatic tissue. There's lots of bacteria that is stored in it. It helps to prevent from various forms of colon cancer. It is very beneficial. Back in the olden days, yes, that's right, back in the 70s and early 80s, they would do exploratory surgery if they happened to have been in the area of the abdominal region with children. They would just pluck the appendix out. Okay, they don't do that anymore because they know we're not born with extra parts. There's need for it. So besides the, let's go back to this again, because what if the person came in with right upper quadrant pain? And again, on a scale of 1 to 10, it was a 10. The patient was having pain after eating a fatty meal, so that would be important. So they ate a fatty meal, then they had pain in the right upper quadrant and pain right between the shoulder blade, the scapula, but on the posterior side. Interesting. Okay. So they have pain in the front and pain in the back. Well, only when they eat a fatty meal. It just so happens that the liver, which we see here in brown, the liver makes bile. And that bile is a very important digestive enzyme that's stored right here in the gallbladder. And when fat is in your stomach, because you've eaten something fatty with your meal, when that fat enters the small intestine, specifically the first part of it called the duodenum says, hey, I got some fat in here. I need help breaking it down. So it's going to secrete a hormone called CCK, which stands for cholecystokinin. Cholecystokinin. The cholecystokinin that the duodenum makes is going to go to the gallbladder, make it contract, push out the bile into the duodenum, and break down the fatty food. That's what it's supposed to do. But, but, what happens if the person has a stone? What if they have a gallstone right here? What if they have a gallstone right there? The bile is trying to get through because there was a fatty meal. They're going to get a lot of discomfort in that right upper quadrant, but also historically pain on the thoracic region near the posterior scapula, right? Just some information that I guarantee you'll end up seeing several times in your healthcare career. Okay. So what do they typically do if the person has this over and over and over? They typically remove the gallbladder. I like to think more functionally because the gallbladder stores toxins. Okay. The gallbladder stores toxins. It stores toxins. It also stores calcium. It also stores cholesterol and water on top of the bile, right? So you have toxins, calcium, cholesterol, and water. Now, what happens if this stays stagnant? What happens if you have water, calcium, cholesterol? All of a sudden, you're going to get a stone that forms in here. And if that stone moves down this bile duct, the common bile duct, it could get lodged. Okay. So, one of the things that creates stagnation is when people are consuming foods that they're allergic to. So when a person is consuming foods that they're allergic to, and I don't mean anaphylactic allergy, like some people can't have peanuts because their throat closes up and their tongue swells, but foods that they're allergic to that don't create an anaphylactic reaction that's life-threatening, but they get headaches 2 or 3 days later. They get itchy skin. They get sinus congestion that's chronic because they keep putting the same food in their system over and over and over and over again. So that type of food allergy can damage and break down the epithelial lining of the intestines. And if you start to break down the lining of the intestines, the inner part, when the fat goes from the stomach into the intestines can't realize there's fat to even send CCK to the gallbladder to make it contract to push out bile to break down the fat. So if the intestines are becoming damaged because the person's putting the foods that they're allergic to, that allergenic food is going to break down the lining of the intestines so that they can't produce CCK to go to the gallbladder to produce bile to break down the fat. You get stagnation of this stuff in the gallbladder. You get a stagnation of toxins, the stagnation of calcium, cholesterol, and water. If water's not moving and you have toxins, cholesterol, and calcium, you're going to get a stone. And I'm sure that that is something that no one in this class has ever heard of before. But from a functional perspective, that's one of the causes of gallstones. Okay. All right. Now let's look at the regions. So we have 4 quadrants, but we have something called 9 regions. Now, these 9 regions, let's start at the center. We have the umbilical region. Then we have an epigastric. Epi means above, gastric is stomach. So there's an epigastric, and then there's a hypogastric. Hypo means below. So epigastric, hypogastric. The other name for hypogastric is called the pubic region for obvious reasons. That's the pubic region. All right, let's look near the groin over here. So we have a left inguinal region and a right inguinal region. Let's look at the lumbar region. There's a left lumbar and a right lumbar. Now, sometimes those lumbar regions are also referred to as the flank. So you have a right flank and a left flank. They're interchangeable. Whenever you hear the word chondria, that's ribs and rib cartilage. So there's a left hypo, meaning under the ribs, hypochondriac, and a right hypochondriac. Chondro means cartilage. So we're talking about the rib cartilage. There's a right hypochondriac and a left hypochondriac. Okay. So now this has shown up in the past, and it's a drag and drop. Again, you'll have like the options here off to the side. So we know that this is the umbilical region in the center. Epigastric, above the stomach, is above it. Hypogastric or pubic region is below it. We have a left inguinal, a right inguinal, left lumbar or left flank, right lumbar or right flank, they're interchangeable. And then a left hypochondriac, again, chondria, chondro, cartilage, rib cartilage, and then a right hypochondriac. Okay. And then again, here's your tic-tac-toe sign for the 9 regions. And then again, you can see that you have different organs in these different regions. Most hospitals, most clinics, they use this quadrant or quads more so than the 9 regions. Okay, but you should be familiar with them both. Okay, now let's just look at these planes. This is important because a lot of diagnostic imaging is taking pictures of the human body in different planes. So we can look at an MRI or a CAT scan or an X-ray of an individual laterally, looking at them from the side, which is a sagittal plane. We can look at them back to front or front to back in a frontal plane. Or we can look at them from bird's eye view, looking down within the body or looking at the feet upward in a transverse plane. So we have these 3 planes. And again, when we look at the individual, whenever we cut the body in this direction, let's do here, give me a second, whoop, right here, going from back to front in this direction so that it separates the person into a left half and a right half, they call that the sagittal plane. Now, if it's directly in the center, they would use the word mid-sagittal. Mid-sagittal plane is right down the center. If it's parasagittal, it's still going to divide the body into a left and right half. It's just not going to divide it evenly into an even right and an even left half. So it's mid-sagittal or parasagittal. When we go this way, separating the body into an anterior part and a posterior part, they say it's a frontal plane. And the frontal plane is also known as a coronal plane. Coronal. So coronal or frontal are the same thing. And it just so happens within the human body, there is a suture. When you do osteology next week, there's a suture that goes right down the center of the skull that separates the skull into a right and left half. They call it the sagittal suture. So the sagittal suture is in this sagittal plane. Then going across that way is a coronal suture. The coronal suture, which is a frontal plane, separates into a front and back half. And then the transverse plane is cutting it into a superior and inferior half. So there's a bird's eye view looking down into it or looking upward. Okay. So if we cut the person this way, this is your transverse plane. If we look at this one in the center right here, that's your sagittal or mid-sagittal. That would be more appropriate, mid-sagittal. The one off to the side, that's your parasagittal. So they're both separating into a left and right half. It's just the mid-sagittal is an equal left and right half, but the parasagittal would be an unequal right and left half. In this particular drawing here, the parasagittal is running right through the clavicle. So we'd say that that's running mid-clavicular or a mid-clavicular line. So this mid-clavicular line is also parasagittal. Okay, then you had like a drag and drop. So here were the terms coronal, mid-sagittal, parasagittal, and transverse. And then you have to like drag and drop the proper definition. So let's start with mid-sagittal. Well, that's going to divide the body into equal left and right halves. But parasagittal divides the body into an unequal left and right section. The transverse divides the body into a superior and inferior part. And the coronal, aka frontal, separates into an anterior and posterior section. Okay? So now let's look here and let's look at the question, because everyone wants to go, oh, that's the right lower quadrant. I know that. Let's call it the right lower quadrant because that's what this highlighted region is, but that's not what they're asking. Look, what is the medial border of the highlighted region called? Oh, so they're asking like two for the price of one here. So this is the superior border. This is the inferior border. This is the lateral border. And this here's the medial border. So the medial border is going to be the sagittal plane or mid-sagittal plane. Okay. What about here? Oh, I know what that is. That's going to be the left hypochondriac region. Well, you're right if it was asking that, but they're not. They're asking, what is the name of the line that makes the medial border of the highlighted region? Okay, so here's the lateral border, here's the inferior border, here's the superior border, and here is the medial border. So that's going to be either parasagittal or mid-clavicular because it's crossing the clavicle, mid-clavicular region. Okay, we'll take a break and then we'll come back and we'll finish with our last section, which is body cavities.